Existential therapy. The key figures in existential therapy are the ones really rooted in literature and philosophy. Dostoevsky, Kierkegaard, Nietzsche, Heidegger, Sartre, and Martin Buber. Early European existential therapists were Ludwig Binswanger, Medard Boss, and especially Viktor Frankl. And contemporary spokespeople are Rollo May and Irvin Yalom. The approach focuses on the central concerns that are rooted in a person's existence, that is, loneliness, isolation, alienation, and meaninglessness. The basic philosophy and the assumptions behind it are that the significance of a person's life is found not through well-defined therapy techniques, but emphasizing choice, freedom, responsibility, and self-determination. In essence, we are the author of our own lives. We're thrust into a meaningless and absurd world, and the challenge is to accept this aloneness and create the meaning in our life. The awareness of our eventual non-meaning acts as a catalyst so that we can find meaning. There are 6 key therapeutic concepts. 1, we have the capacity for self-awareness. 2, because we are basically free beings, we accept the responsibility that accompanies our freedom. 3, we have a concern to preserve our uniqueness and our identity, and we come to know ourselves in relationship to others. 4, the significance of our existence and the meaning of our lives are never fixed once and for all. We recreate ourselves through what we do. 5, anxiety is a part of the human condition. And 6, death is an inescapable fact of who we are. And in fact, coming to terms with the reality of our death is what gives our lives meaning. The therapeutic goal, then, is to enable the individual to accept the freedom and responsibility that goes along with that freedom. So the approach is to help the client to recognize the ways in which they are not living authentic lives and to challenge them to make the choices that will help them to become who they can be. So, you help people see that they're free and to be aware of those possibilities. You challenge them to recognize that they are doing something that they formerly thought was happening to them. They're actors and not reactors. And finally, to recognize the factors in their lives that are blocking their own freedom. The therapeutic relationship, then, is one of somebody trying to help the client understand who they are, to recognize their potentialities, and to help them go beyond what's blocking their way. The applications are especially appropriate for those seeking personal growth. It can also be useful for clients who are in some sort of life crisis, getting fired, getting a divorce, retirement, transition from one stage of life to the other. Clients experiencing anxiety rising out of these existential conflicts of making key life choices, accepting freedom and responsibility, and facing the anxiety of their eventual demise. The contribution is that the essential humanity of the individual is highlighted. The person-to-person therapeutic relationship doesn't lend itself to a dehumanizing therapy, but the limitations are that many of the writers use vague and global terms, ones that are often difficult to grasp. If you've ever read Kierkegaard, you can understand that. It really hasn't been subjected to rigorous scientific testing because of its vagueness, and it has limited applicability to lower functioning clients because you really need to grasp these existential concepts in order to get them, and people who are in extreme crisis who need immediate direction, poor clients, and those who are nonverbal. Here are some specific terms that you need to remember. Existential neurosis, that is the feeling of despair and anxiety that comes from inauthentic living. An existential vacuum, the condition of emptiness and hollowness that results from the meaninglessness of life. Freedom, the inescapable aspect of the human condition that we need to grasp in order to be fully human. Logotherapy is the therapeutic model developed by Viktor Frankl and really means healing through reason. Focuses on challenging the clients to grapple with their lives and to find meaning in who they are. And finally, the three terms that are really keyed into this: Mitwelt, the relationship with others; Umwelt, the relationship we have with our environment; and Eigenwelt, the relationship that we have with ourselves, or as the term literally means, self-world. Well, that's what you need to know in order to pass the test. Good luck.